setting the stage, the big picture first is what you always want to understand. The big picture for personality disorders. When we start talking about them, you'll see a little bit of yourself in multiple diagnoses. It doesn't mean that you have a problem yet. But society sets the rules, and here's how society sets the rules. Society says you can be whoever you want to be, because everybody always says, hey, that's just me. That's fine, be whoever you want to be. Army says be all you can be. But society says when being you bothers me, you got a disorder. Society sets the rules on what behavior is acceptable and not acceptable, just so you know. When you're doing something that bothers other people in society, then we say you have a disorder. But otherwise, you can have multiple different types of, or rather features of these personalities, and that's just bits and pieces of what makes up who you are. But as long as it's not interfering with social function, then it's not a disorder. Okay? So that's the big picture. So what we're going to do is go through each one. Again, just a minor differences in how to separate this personality disorder from this personality disorder. That's what they're going to be asking. On the boards, they'll describe a person, their traits, their actions, and then in the end, they'll ask you, okay, what is the diagnosis? That's why I would say read the question first, because the question just says, what's the diagnosis? As soon as you come across the clue that tells you exactly what the diagnosis is, stop right there. Answer the question. Get out. That means the rest of the information is irrelevant to the question. Okay? It's called distraction. They want to see if you're able to focus. One of the things they're always testing on the boards is your ability to focus. Why is that? That's what a doctor does for a living. That's what a doctor does for a living. Let me give you an example. Let's say a patient comes in to see you. This patient has a history of lupus. Then he has a history of having had folate deficiency a couple of months ago. But then today he comes into your office and he's bleeding all over the floor. He's got a knife stuck in his back. His girlfriend is still out in the waiting area yelling at him for coming home at 3 o'clock last night, talking about he was out with his buddies again this week. And he sits down, bleeding all over the floor. He looks at you, doc. I'm feeling a little weak, short of breath. Could you help me figure out what's going on? Now, the student doesn't know how to focus. We'll start thinking, well, let me see. He has that history of lupus. Maybe he's got a hemolytic anemia going on right now. Oh, that's right. He had folate deficiency 2 weeks ago. Maybe he's got a megaloblastic anemia. My way of doing it, clue. Knife in the back, girlfriend's handprints are still on it. I'm betting he's bleeding internally, folks. That means go with the one they give you a clue for. The one you have to do all that discussion to figure out, that sounds good, but you won't be getting many points for those. Okay? The test writer gives you a clue. You want to ignore it and come up with a new explanation. The reason why they're trying to make sure you know how to do that is because the patient will come into you and give you clues, folks. If you ignore that, well, sure, you come up with a great diagnosis, but that's not what the patient has. And before you know it, you're chasing something new, but it's not what the patient came in with. And, of course, patients are complaining about that quite often right now about physicians. All right, so personality disorders. What do we need to know? First personality disorder, dependent. Dependent personality means a person who has an incessant need for reassurance. Has to have his or her ego stroked at all times. Dependent personality. Incessant need for reassurance. For the guy, he'll be like the most popular guy in school. He's the jock. All the girls love him. All the guys think he's just the best athlete around. You would never know that that person has a very dependent personality because you've created a monster in him. Now, if he doesn't hear how good he is every day, they get depressed real fast. The most popular girl in school, same thing. She's so pretty. She's got money. Her family's got money. But if she doesn't hear how pretty she is, that she's got the best hair, the best car, best everything, she gets depressed real fast. Suicide, folks, is higher amongst the rich than it is amongst the poor. People always think poor people want to kill themselves because they're poor. Nah. There's a big difference between never having and don't know the difference versus you used to have and now you don't have. That's a big problem. All right? I grew up in the city of Chicago in one of those what we call the hood. It's called survival of the fittest, right? So that means you get government cheese. Now, you got to understand there's a difference between government cheese and government cheese that we got. That government cheese is that one that's the hardest to break. You can use it to put in nails in the house and then slice it up at lunch and get yourself a cheese, cheese sandwich for lunch. All right, so crazy. Same thing here. If you've never had, well, what do you know? You don't know any difference. So mom can't pay a bill today. Well, she couldn't pay a bill last month. It doesn't depress you. You don't answer the phone when the bill collectors call. Okay? So dependent personality usually comes from somebody who's actually much more well off. Now, a lot of men like to think women are dependent or much more dependent. And women like to think men are much more dependent. Well, what's the jury say? Men are much more dependent. But there's a difference in the dependencies. Here's the difference. Men are egotistically dependent. A man's got to have his ego stroked at all times. That's just the way men are. Years ago, I used to ask married couples who came to my office, and I'd say, what's the secret of being married for a long time? You know, because, I wasn't married yet, so I just wanted to find out, how do you stay married for so long? You know, you ask a guy, hey, what's the secret of being married for so long? He said, man, just give her whatever she wants. And then I asked a woman, I said, what's the secret to you being married for so long? Just let him do whatever he wants. That's because in the beginning, you're fighting about things, and after a while, you realize, let's say a guy wants to go bowling with his buddies on Tuesday night. And at first, the woman puts her foot down, no, you can't be going with your buddies. You got to stay home, spend time with me, spend quality time with me. You got to cuddle up with me because I need you to cuddle up with me. All right, fine. I'll cuddle up with you, but it's going to be a hell of a bad night now because the man is pissed off. He's not out bowling with his buddies. So these women would always tell me, after a while, you realize, hey, let him go bowling with his buddies because that way when he came back, he was in a better mood, and then boom, all those arguments stopped about bowling. Okay? And that's what happens. So a man needs his ego stroked, so a woman realizes stroke his ego, he's happy. If you stroke his ego, hey, he just passed to that wallet, man. You got to ask for it. It's coming your way anyway. All right? Make a man feel like a king, boy. Credit cards, do whatever you want, babe, have a good time. Now, for a woman is emotionally dependent. Men, we don't know what emotions are. What the heck is that? Emotions. A woman will tell you she remembers the day we had that first date. You're like, oh, yeah. Yeah, see, wasn't that a little cafe? Oh, yeah, restaurant. Yeah, that's right. It was that restaurant. And then, wasn't that along that real nice road? Oh, along the beach. Yeah, that's right. It was along the beach. My goodness, man, we just kind of go with wherever the conversation. I want to remember the first kiss. First kiss, you can't remember nothing. You can't remember yesterday what you were supposed to do. And she remembers the first kiss from 15 years ago. See, those things are important to a woman. Men are not that emotional. And so that's why a man can't remember that stuff. And so a woman does not understand a man's mind works totally differently. And that's why, what's that, men are from Mars, women from Venus, that kind of thing, is learning what each other wants, folks. If you're in a relationship and you want that relationship to work, you got to talk to each other to find out what the other side wants. And then have a compromise so that the other side gets what they want. Because that's what's gonna happen if you want peace and love and, that fairy tale forever type relationship. Because otherwise, if you're always fighting about stuff, oh, man, that's why a lot of relationships end up breaking up. Because you think, oh, I can't put up with this all the time. But it's going to be the same thing when you meet the next person. It's always the same stuff. So, dependent personality needs reassurance at all times. Then there's conduct disorder versus antisocial. The dividing line is age 18. We say under age 18, conduct disorder. That's a nice soft word. Conduct makes it sound soft and gentle, and you can be rehabilitated. Antisocial, look at the word, it says you're against society. That means forget that, lock him up. We don't want to be bothered with this person anymore. All right? Which means it's rare. You can be rehabilitated. So that's why they have a dividing line. The dividing line used to be age 14, but they moved all the way up to age 18 now. So conduct disorder. The problem here, they show no remorse. They show no remorse. These are people who lie, steal, cheat, destroy property. They could care less. Good example, the gangbangers. Antisocial. Years ago they did a research on the gangbangers and asked them, what makes you such an angry person? Now I grew up in the hood, so I used to run from them too, And when I saw this information, though, it almost made me cry. They asked them, what makes you such an angry person? You know what the number one response was? My father was not around for me. My father was not around for me? This is a hard-nosed, cold killer who, shoots at people who's shooting at him, and they cut each other up and everything else. And he was more concerned. His anger at the world, it's like the world did something to him. His father was not there. I remember on the Maury Povich show years ago, they had one gangbanger on there, and they brought his father on by surprise. He didn't even know his father was coming on. And the kid just started crying. And, his father pleaded with him to get out of the gang, and he just broke down and said, I'll get out of the gang if you promise never to leave me again. And I had to cry on that one. I had to cry on that one. Folks, there's a soft side to these people who are cold killers. That's why there's such a big push for mentoring programs. If you didn't know that, that's where it came from. Because now we realize that is the lack of men in another male's life that makes it hard for them to have respect. It's not that women cannot be good fathers, folks, but they're not as effective. Why? Male children are more likely to respect the deep male voice than a high-pitched female voice, no matter how much of a disciplinarian mom is. Give you an example. Let's say my son. Every now and then my wife wants to be the disciplinarian. I say, hey, have a good time. I'm watching the game anyway. You go ahead, take care of it. All right, so I'm watching the game. She's over there talking to my son, and they're just yelling back and forth, back and forth. You got to do this. And then, of course, he's got a story about it. And they go back and forth. I'm just watching the game. Okay. And then after a while, she says, all frustrated, she comes up to me, you handle it. I get up, put my remote down. I walk over there. What your mama say? Get your ass over there and watch some dishes. And I walk away, back to the game. Start watching the game. Guess who's doing the dishes in 10 seconds? See, that's the difference. Because the female's voice is so high-pitched, they're not scared of it. That's why they sit there, they debate with mom, they argue, they have a conversation. 2 hours later, they still haven't got the dishes done. I'm like, no, I got to watch the game now. You get them dishes done, just so we don't have to talk about this anymore. You know, so it's so important to have a male role model in another male's life. All right, so remember that when you got, like, say, a single mom who's doing her best to take care of her child, help her out. If you know about, Big Brother, Big Sister program, tell her about it. Get a mentor in this young man's life. Because the number one thing they found in this disorder is a chaotic upbringing. That means it's usually single-parent family. Well, that's 60% of blacks and Hispanics, and it's usually the mother. When the father is missing, male children run wild. Okay? So conduct antisocial. Narcissistic. Narcissistic is somebody who thinks the world revolves around him or her. Narcissistic, the person who's egocentric, self-centered, thinks everything revolves around him. For that reason, Kathia, they're real sensitive to criticism. They don't think they're ever wrong, right? So let's say they misspell a word, Thomas. You say, hey, man, I think you misspelled that word. Oh, no, man. See, Webster misspelled it way back in 1865. When he writing that book, no, he got it wrong, see? So this is a real way to, oh, my God, this man, Webster's dictionary now is wrong and he's right. He will give you the best explanation for why he's right and everybody else is wrong. So narcissistic, real sensitive to criticism. They do not ever believe that they're wrong. So if you do try to prove them wrong, it's going to be a lot of waste of energy. But they get real sensitive if you try. Okay? So narcissistic. Borderline. Borderline personality. The person who's borderline crazy, borderline sane. You don't know what they are day to day. Borderline personality sees things as black and white. They either love you or hate you. There is no in between. There is no I kind of like you. They either love you or hate you. There is no in between for borderline. That's called splitting, when they can't see any gray zone to anything. How do you deal with a borderline personality? Well, when they're in the I love you stage, everything's cool. You don't have to do anything. They love you. They'll say you're the greatest doctor they've ever seen in their whole life. You walk on water as far as they're concerned. That's why they love you. And then one day you can't get them in for a simple illness. You say, well, why don't you come in tomorrow? They're pissed off. You don't even know it. Now they hate you. You're the worst doctor they've ever seen in their life. That person's going to go way out of his or her way to destroy you. They always tell you with a borderline personality, get rid of them. Get rid of them. Why? When they get to the next doctor, they love that person. They stay in the I love you stage for a while. Every time they move into I hate you phase, get rid of them. Because that person becomes your worst enemy. Get rid of them. You should never be uncomfortable in your own office. You don't have to treat anybody, folks. That's what the law says, except in an emergency situation. That means if you and I can't get along, patient and doctor relationship no good, all I have to do is write you a piece of paper that says I no longer feel comfortable with being your doctor and send you on your way. It should always be a certified letter. That way there's no mistake and they got that letter, okay? If they have a chronic illness, you need to refer them to someone else. But no law says you have to be the doctor for anyone. Don't forget that. Because if a patient makes you uncomfortable, start moving them to someone else. Okay? Because that's going to mess up your day. And if your day's messed up, it's going to reflect to the other patients. They're going to wonder why you're in a bad mood, why are you snapping at them, and it's really got nothing to do with them, but that's going to ruin your practice. Okay? So borderline personality. They also finally overreact to any small disturbance. The boyfriend is late and they threaten to kill themselves. How the two go, I don't know. I met one borderline female years ago. She was a nurse, and I remember she was an older nurse. Her first husband died. So she was always lamenting how at her age she'll never find another man and all that stuff. And I said, well, don't worry about it. If the Lord wants you to have another man, you guys will run into each other one day. And then, I don't know, maybe a year later or 2 years later, I see her again, and she starts telling me about this man that she met, wonderful man, loves him to death. He's the best man she's ever seen. I said, wow, remember a year ago I told you? If the Lord wants you to have a man, you will meet up with him one day. And she just was so in love. And they were getting married. I think about a month later after they got married, I ran into her again. Came to the same nursing station. And I just happened to, hey, how's your husband? She said, oh, I divorced him. So now this is 30 days later, so I'm thinking maybe he must have beat the heck out of this woman. So I'm feeling bad. So I said, oh, what did he do? And I'm still writing. And she says, oh, he left the garage door open. What? He left the garage door open. I said, because he left the garage door open, that's why you divorced him? She said, yeah, I can't be with any man who leaves the garage door open at night. Flash, borderline. Okay, I'm out of here. I already know this conversation's not going anywhere. I'm not going to try to convince her what she's doing is wrong. Borderline people, that's just the way they are. You're not going to change their mind. Then there's schizoid and schizotypal. Schizoid personality. As you can tell from the words, we thought they were schizophrenics, but they weren't. Simply because of social isolation, social withdrawal. Schizoid people make the conscious decision, Jessica, to not be around other people. You understand, Purnima? Conscious decision to not be around other people. This is the recluse or the guy who lives in the cave. He ran away from you, Thomas. If you come anywhere near him, he'll get violent. Remember, he moved up to the cave to get away from you, and now here you come invading his space. Okay? So because he liked living by himself in the cave, that's why we thought he was schizophrenic. But then after you finally duck all the buckshots you've been shot at, and you actually capture one of them and start talking to them, you realize they are completely sane. They just don't want to be around other people. That was their decision. That's how this term came about, schizoid. Conscious decision not to be around other people. Schizotypal is a person who just behaves so weirdly that other people avoid him. So you would think he was schizophrenic because he's always off by himself over in the corner. Who's that over there? That's Charlie, man. You know, he's just different. You know, back in grade school, there was always somebody in your class. Everybody was always talking about, yeah, that's just the way he is, man. Just leave him alone. I still remember it was a girl named Valerie something in my class. And everybody said, oh, stay away from Valerie, man. She's just weird. Oh, yeah, okay. I didn't know what that meant. But she was always off in the corner, reading a book, doing her own thing, seemed to entertain herself and all that. So then one day, the teacher paired us all up for a project we had to do, and Valerie ended up on my team. And I'm like, oh, my God, everybody says stay away from Valerie. What am I going to do? Now I got to talk to Valerie, you know? And then when we got together, me, her, and somebody else, we started talking. I said, she sounds normal to me. That's when I realized the girl was normal. She just liked being off by herself. So everybody thought she was strange. But if the schizotypal person, they just look like they want to be off by themselves. They prefer to be by themselves. But if you come talk to them, they'll talk to you. They're normal people when you talk to them. That's the difference. Schizoid will get violent if you come near them to talk to them. They don't want to talk to you. So that's why you got two different terms. One does not want to have any contact with you and will get violent, schizoid. One just likes to be by themselves, but if you come to talk to them, they'll talk to you. Schizotypal. That's why they describe something called magical thinking for them. It means they know how to entertain themselves all day long. They can stay by themselves and wouldn't even worry about it. Magical thinking. Third shift night watchmen are good at that. They can work the 12 to 6 shift and just entertain themselves all night long. Just you just see them kind of You're like, what's he doing over there? I don't know, man, but he likes his job. You know? Or the guy who works in a photomat box. Remember the photomat box? Little square box, he can't barely move. But he was perfectly happy just in that little box. How you doing? Come to pictures? You know, pictures. But they were happy in a small box. Most people can't stay in a little closed box like that. All right, so that's schizoid and schizotypal. What about obsessive-compulsive personality? Obsessive-compulsive personality is a person who is anal retentive about everything, which means everything has to be a certain way all the time. Now, that's my wife. I'm not making fun of her because she'll tell you she is. I mean, everything has to be a certain way all the time. She loves to decorate up the house, man. I mean, before you know it, she got it looking like a magazine cover. Me, I like to kick my feet up, watch the ball game and the news. I got no place to put my leg up. There's too many things everywhere. So when we moved to the new house a while back, I said, okay, babe, we're going to make one room, the man's room. You can decorate the whole house any way you want. Leave this room alone. Leave this room. Let this be a man's room so I can just go in here, kick my feet up, and watch the ball game if I feel like it. Okay, honey, I'll leave that room alone. All I know is if I looked around, there's a little rug at the foot of the bed with little dancing girls on it. I'm like, where the hell did this come from? Before I know it, pillows with bunnies on it. I'm like, where did these bunnies come from? And let me tell you something. People with OCD, women are good at OCD. Women will train a man. Train you without even knowing. You don't even know what's going on. A man swears, yeah, I wear the pants in the house. Yeah? Who told you which pants to put on today? And women do it on the slide too, man. Let's say you put the slacks in the shirt out, you think you're going to look good. Here comes your woman walking by. I know you ain't going to wear that. Well, you know, I just kind of checking it out, making sure everything matches. Next thing you know, you're back in the closet trying out another combination. That's how they get you, till they train you. Because I remember my wife, you know, we got the bed, and then there's 2 pillows on there. And she said, now, you got to make up the bed real nice when you wake up in the morning. I'm like, babe, you know, I got to go to work. I ain't got time to be doing all that fancy folding and stuff you're talking about. She said, no, you got to make the bed look nice. I said, why don't we just leave it down like this? It makes it easy to slide back in tonight, you know? She said, but no, in case company come over, you got to have a nice look. I said, babe, I didn't invite nobody over here. I don't care if I know company come over here. Let's just leave this stuff down. First, I started with 2 pillows. Next thing I know, it's 4 pillows. Then 6 pillows, 7 pillows. Damn, pillows are having babies while I was at work. Every time I turn around, there's more pillows on there. There's so many rows. Before you know, about 17 rows are on there. Like, good Lord, it's going to take me all morning to do this. So I ain't doing that. I said, no, you got to do it. God, I ain't doing that. No, you got to do it. Every morning, we're having this argument. Until one morning, I wake up. I said, man, I don't want this one yelling at me this morning. So, you know, and then I start walking away, and I'm like, hey, wait a minute. I turn around. Oh, no, I've been trained. No. 17 rows of pillows. I put her exactly the way she wants. See, a woman knows exactly how many times you got to yell at you before you start doing what she wants you to do. See? But men don't know what's really going on. You just think, oh, I'm just tired of her yelling at me all the time. No, she is training you, bud. If a woman wants your opinion, she'll give it to you, get back to her. That's how it works. That's how it works. Let's say my wife wanted to paint the dining room a different color. And she said, yeah, I want to paint it whatever, some shade of red. I said, red sounds good to me. And then she brings all these swatches back. I'm like, what's a swatch? She said, little pieces to show you what color it is. I said, oh, I didn't even know they had something like that. She said, okay, here's all the colors of red. I said, dang, I didn't know there's this many shades of red. She said, yeah, no, you gotta help me pick it out, honey. I'm like, okay. So then what do? You start looking at the colors. And then you start going towards them, what kind of? And then all of a sudden she makes her face. Oh, okay. I mean, she don't like that one. You start moving towards another one, and then she makes another face. Okay, she doesn't like that one. Then after a while, you start looking for hints from her face. Am I getting even close? And then she starts smiling. Yeah, this one right here. I like this one. I said, thank you, honey, for your advice. I said, oh my God, we got to go through this routine all the time. There it is. Now you got my advice. You can go ahead and paint it whatever color that thing is. Anyway, so OCP, anal retentive. I remember one time I was down in the basement. My son and I were watching TV. And she had this vase and all these things on the round table. So I said, man, I need someone to put my feet up. So I moved the vase and stuff over, put my feet up. And then she came down in the basement. We're sitting there watching the game. And I forgot to put the vase back. And all of a sudden I hear behind me, who the hell took this stuff off the table, making it look crazy like that? I said, look at my son. I said, oh, Lord, son, you got to take one for the team, baby. Take one for the team. Come on, man, take one for the team. Remember them Nikes you've been asking me about now? Because I knew I was in trouble. Oh, my goodness. Anyway, so that's how you know somebody is OCD. Just don't like anything to be rearranged. It's got to be exactly the way they put it. All right, then we got passive-aggressive. Passive-aggressive. Women are good at this one, too. These are mostly women. Now, I'm not trying to be sexist about it, just so you know. Women are real good at this. Well, passive-aggressive is the person who does by not doing. Does by not doing. Let's say you got your wife mad, or your wife is mad about something. She won't tell you. You just have to figure it out when you get home. So I come home, and I say, hey, what's for dinner? And then she looks at me and says, what'd you bring home? I said, oh, Lord, that means I'm in trouble for something. Now I'm starting to run all the dates through my head. When a birthday, anniversary, I'm trying to say, okay, what did I forget? I'm not sure. And so you start, okay, well, you probably want to, you want to go out to dinner, huh? Nope. You going to cook? Nope. What, you want to order out? Nope. Can we just go out and get some ice cream then? Nope. Well, can we just cuddle up and eat some chips or something? Nope. Good, why you acting like that? Acting like what? See, does by not doing. You say, you can't treat me that way. I didn't do anything to you. You see that? Does by not doing. So by not interacting with you, that irritates the heck out of you. That is the offense, by not doing something. Okay? Now, let's say you got the passive-aggressive patient, or let's say patient first. Passive-aggressive patient keeps coming late. Every time you tell them, no, Miss Johnson, you got to be on time because I got to keep people on schedule in the office. And every time they're minutes late. They got every excuse. Even though they know it irritates you, they still do it again the next time. That's passive-aggressive. Does by not doing. Always say, I didn't do anything. I didn't do anything. And then let's say passive-aggressive employee. Let's say the employee is mad about Ms. Johnson getting on your nerves. So what is she going to do? Do the same thing back. So let's say the doctor has two or three spots for emergencies that call in that day. And Ms. Johnson calls in, say, well, I got to get my son in, or I need to come in. Say, well, the doctor's booked up today. Say, but I thought he had a couple of positions in case of emergencies. Well, he's running kind of behind, and, I can fit you in tomorrow or next week. I mean, she will not give her those emergency slots. That's passive-aggressive. Again, doing by not doing. Okay, that's the passive-aggressive person. All right, then we've got the conversion disorder. Conversion disorder is somebody who has a neurological manifestation of an internal struggle. That means something's going on inside, so they manifest it neurologically. Good example, a child sees his parents having sex and he goes blind. So, Lord, what the heck was that I just saw? Children always think parents don't ever have sex. It's like, how did you think you got created? But it bothers them, the thought of their parents having sex. And then the vision of it, oh, no. They'll just go blind for a while. Or another one is a guy who, let's say, beat his girlfriend or wife and then loses function of his right hand. The same hand he slapped his woman with. He just loses function. Now, when they come into your office, they act like, it doesn't really bother them. That's because back in the mind, they know why it's happening, but they're not going to tell you straight out exactly what it is. You really have to dig to figure it out. Okay? So conversion disorder is a neurological manifestation. So on the boards, they'll tell you, if let's say some woman who broke off with her boyfriend and all of a sudden she's had numbness of her right leg or her left leg, that kind of thing, I know they're going for conversion. Okay? An internal struggle, neurological problem, you say conversion. Okay? Then there's factitious. Factitious is somebody who fakes an illness just for the attention. Fakes an illness just for the attention. Now, under factitious, they now have Munchausen's because that is factitious. Munchausen is a mother who fakes her child's illness for the attention. So anybody who fakes an illness strictly for attention, we now just say factitious. If you add by proxy, you know, the old Munchausen by proxy, this one is subconscious. See, factitious is conscious. A child knows they'd rather be at home having a good time with mom, so they fake an illness just for mom's attention. That's it. There's no payoff after that. It's conscious. He knows what he's doing. And that's why if you catch him, then he confesses. By proxy, it's subconscious. They don't even know they're sick. This is the mom who goes as far as making her child ill just so she gets your attention. That's what makes them dangerous. They don't realize that's an illness, to make your child ill. There was one story where a child kept coming in with urinary tract infections caused by gram-negatives and anaerobes, and they kept thinking, what the heck is going on? How can a small child be having big-time gram-negatives and anaerobes? So they thought there's got to be a fistula somewhere to the colon. So did a lot of mega workup, including surgery, looking for this fistula. Could not find it. But one time the nurse barged into the room real quickly, looked for something, and caught the mom in the act. She was injecting feces in the IV bag. That's the only way you catch these people is in the act. So that's why Munchausen by proxy. Because it would take 4, 5, 6 dead children to catch away one of these people. And then on top of that, folks, if you catch one of them, guess what? They're not in their right mind, are they? It's subconscious. They don't even know they're ill. You can't even prosecute them, which means they go to a psychiatric hospital, but that's not jail. So imagine you're the parent and you find out who killed your child, and you realize you can't do a thing about it. That hurts. So that's why now what they do is anytime there's a child who dies under suspicious circumstances, all adults involved go into a computer system, national registry. Therefore, if that same parent or that same adult goes someplace else and kills another child in the process, their name enters the computer again. The computer was a ding, 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 ding. Hey, wait a minute. This is the same person that was involved over here. And they finally catch up with him. But you do understand, folks, 2 children have to die before they finally figure out. But look how many used to die before. That's why I said we can't save 100%. But at least by forming this national registry, we can limit it down to 2 children before we can catch one of them. You know, and then put them away in a psychiatric hospital. Okay? So factitious by proxy. All right, then there's what's the guy who always thinks he's sick? Hypochondriac, sorry. All right, so hypochondriac versus somatization. Hypochondriac thinks he has the same illness every time he sees you. Key point is the same illness. Somatization feels he has a different illness every time he sees you. And then second, hypochondriac is conscious of his problem. He knows what's going on. Somatization is not. For men, hypochondriacism is usually the most common is chest pain and MI. Let's say your brother died at age 40 of an MI. The closer you get to age 40, you start getting nervous too, that you're going to die of the same thing your brother died from. Because he was normal until he dropped dead. So you think, well, I'm normal. Well, what says I'm not going to drop dead at age 40? So every time you get to age of chest pain, oh, doc, got chest pain. You got to make sure I'm not having a heart attack. You remember my brother died at age 40. See that? You hear that every time they come to see you. It's always, oh, doc, it's always chest pain. They're worried about a heart attack. For women, breast cancer. Sister, cousin died of breast cancer at age 35, 40, 42. Ooh, the closer they come. Every lump, everything that happens, they're in your office. Doc, you got to check it out. I want to make sure it's not breast cancer. Okay? So hypochondriac. The somatization disorder has a different illness every time you see them. By DSM-4 criteria, they have to have at least 5 organ systems involvement. Well, that's easy. If you ever had one, every organ system is involved. Okay? And so that's how you know they want somatization on the board. They'll tell you he's had, GI problems, GU problems, neural problems, skin problems. I mean, they just name off 5, 6 different organ systems. Aha, that's how I know it. They want somatization as the problem. Okay? Because they don't know they're ill, they'll consent to any workup you suggest, even surgery, biopsies, any procedure, even when there's a lot of risk involved. I had one such female in my practice in Peoria. Young girl was in her 30s. She had beautiful twin daughters. And I remember every time I saw her, there was something else. I'm working her up, trying to figure out what's going on. Nothing. I mean, mega $1 million workup. Nothing ever turns up. And then one time her mother-in-law came by my office and said, did Penny tell you about her other doctor? Huh? What other doctor? Never told me anything about the other doctor. Had to do some research, find out she had seen another doctor before, and he did the same mega workup I did. Found nothing. The problem was, after I left my practice in Peoria, about a year after I came down here, somebody got word back to me that Penny was dead. This is a woman in her 30s, which means from consenting to so many procedures, sooner or later she died in one of the procedures. That's the danger. The somatization disorder is a danger to themselves. They don't even realize it. Okay? So hypochondriac is conscious, somatization, subconscious. Hypochondriac complains about only one problem. Somatization complains about many problems. Everybody understand the difference? All right, so that's somatization disorder. Then there's dissociation and dissociative fugue. Dissociation disorder is somebody who creates a new personality with a feature he or she cannot handle. The example I like to give is a young woman who was married and got divorced. She has one child, though. So she gets kicked out of the house by the unfeeling or uncaring husband. And so now she's out on the streets, no education, no job, and she has a child. And then, in her mind, fortunately, some guy that she knows says, why don't you come stay at my apartment? And she's happy, oh, great, someplace to stay. Except that night, he offers to sleep with her for money. So she thinks about it, hesitant, but then, oh, well, I need the money anyway, so she does it. A few nights later, she does the same thing, sleeps with him for more money. Sleeps with him for more money. Before you know it, she got plenty of money. She moves out, has her own apartment, buys her own car, puts the kid in a nice school. Everything's going real nicely. Except one day, she looks at herself in the mirror and says, oh, my God, I'm a prostitute. Because that's exactly what she's become now. She can't handle it. So she says, no, I'm not a prostitute. So she separates the two personalities. Candy is the prostitute. So that means when she's out sleeping with guys, she's called Candy. When she's at home, she's Amanda, the good mother. Because after all, she's doing all this to take care of her child. See, now she can deal with it. Because Candy's over there, she's over here. But the problem is, one day, they'll run into each other. All you gotta do is watch the soap operas, because they always run into each other on Friday. So anyway, so here comes the mom coming down to her next client, and then little Bobby coming around the corner. She's got her leather on and boots and a whip, and then she's walking out, and then all of a sudden Bobby coming out, dragging his little teddy bear. Gee, mommy, where you going dressed like that? And then all of a sudden, oh my God, I'm Candy. Tune in Monday if you want to find out what has happened. Okay, so they will run into each other, and then of course she can't handle it. So that's the problem with dissociation, is because you still haven't dealt with the problem. Dissociative fugue is somebody who leaves their past, completely leaves their past. And this is subconscious. They don't even know they've done it. Subconsciously leaves their past and starts a whole new future. That means, folks, there's no memories of anything. It just starts here, September 1972, and you're 50 years old. Okay, let's start at that point. They have absolutely no recollection of anything behind. Why did this happen? Something traumatic set this off. Something traumatic set this off. There was one movie, I think it was called A Stepfather. East Coast mom, she lost her husband, and then she met this guy, and she couldn't believe that she found love at her age. Things were going fine, so I think she had 3 daughters. And this guy had no past. He was just squeaky clean, just the kind of guy she liked. Well, one day they're walking through town, and all of a sudden they run into another guy who knows him from the past. And the guy, hey, Charlie, what's up? And he's like, hey, what you doing, man? You remember, he starts talking about all kinds of things like he knows the guy real well. And, of course, the guy has no memory of this. He's like, excuse me, sir, my name is Charleston, whatever. I don't know you. And then they walk away, and, of course, the wife is like, he sure acted like he knew you. Every time they run into that man, he started blurting out stuff about the past again. And the guy was saying, I don't know you, sir. I mean, how do you know this about me? And then one day, the guy blurted out something that the wife recognized. So she looked it up in the newspapers, and she found out who he was. He was a guy from a neighboring town who had killed his wife and his kids. And, of course, the trauma of the whole thing, they never caught up with him. He ran to this town and just started a whole new life with no past. The thing with fugue, folks, is if somebody from the past doesn't catch up with you, you would never even know you've done it. Now, you're going to run into a lot of people with fugue. It's not as rare as you think. If you work at any city clinic, folks, you'll run into a lot of them. A lot of them are homeless people. We have a clinic, when I was in Peoria, we have a clinic just for that. Because when you talk to them, they have no past. What do you mean you have no past? They don't remember their mother, their father, their sister, their brother, where they were born, nothing. They just remember like last week. I mean, wherever it started, that's it. That's all they can tell you. How can you have no past and you're in your 40s and you have absolutely no past? You don't remember your brothers, or sisters, parents, nothing. But that's what you're going to run into. A lot of homeless people have fugue. Because there's no such thing as a man without a past, okay? But that's what fugue is. All right, then there's body dysmorphia. Body dysmorphia syndrome is somebody who's obsessed with a part of their body and is never pleased with it. That's the old Michael Jackson syndrome. Obsessed with his nose. But that man was on Larry King talking about, I only had one procedure on my nose. Hey, Mike, have you seen the same pictures I'm looking at here, man? I mean, they were flashing all these pictures like, man, he's had so many surgeries on their nose. But you ask, I mean, but ever since he was a kid, he was obsessed with his nose. He's never been happy with it. All right, so that's body dysmorphia. You see that in people who are bulimics, because they're never happy with their bodies, and anorexia nervosa. They're never happy with their bodies either. Okay? Their anorexia nervosa, remember, is the person who's well below the ideal body weight, but still thinks she or he is too fat. Versus bulimic, who's usually normal or just above their ideal body weight. They're usually chunky people because they like to eat, so they just eat purge. That's the big difference to separate out the two, because otherwise, both of them purge, both of them vomit, both of them use laxative. You got to look carefully. The anorexia, they have the excessive body hair because they've lost so much of their body fat, they can't even maintain enough estrogen. Okay? So whereas bulimic doesn't have that. So body dysmorphia. All right. Any questions on personality disorders? Can anybody think of anyone on here that I've missed? Okay. Just want to be sure. All right. So now defense mechanisms. Yes, sir. That's right. That's usually after borderline. I forgot to do that. Yes, histrionic. The histrionic personality is the person who's overly flirtatious and flamboyant. So let's say if you're a female doctor, you got a male who's histrionic. He comes to your office. He's the one that shows up in your office with cut-off shorts and white beaters on because he wants to show off his muscles to you. You say, Mr. Johnson, hey, what time is it? Well, let's see now. Striking a pose, trying to show off his muscles right there before he even tells you what time it is. All of a sudden, you hear cameras. Vogue, 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 Vogue. All right, for the male, let's say if you're a male doctor and you got a female who's histrionic, that's a woman who comes to your office dressed so provocatively, and yet it's just an ear infection recheck. Like, what is this all about? You can tell, but the best way to deal with a histrionic person is at first ignore them. Remember, they're looking for your attention. But you don't want to give them the attention. So you just ignore them. Then after a while, most of them will just give up because they can't seem to get your attention. That's the reason why she's dressed so provocatively. She's hoping you'll notice her. Folks, it is never a wise idea to ever date one of your patients. Don't do it. There's actually one question on, I think it's USMLE World, and said, you can't be their doctor and then wait a year and then ask them out. And just don't even do it, period. Period. Once you've established a relationship as patient-doctor, if you start getting romantically involved with that patient and something goes wrong, guess what? She can come back and blame you. You have absolutely no leg to stand on. So as I'm telling you, you hear about some of your attendings who are doing that. That is not a wise idea. Because as long as the relationship is fine, okay, fine, but wait till it goes sour. She has a lawsuit against you now. And you got no leg to stand on because what you did was wrong from the beginning. Simply because she's always looked up to you as a person in power. The law says you can't do that. Because that can always be conceived as coercion. She felt pressured to do things. All right, so histrionic. Be careful of the histrionic person. Again, at first ignore them, but then if they start to get too personal or touchy, then you write them that letter, so you got to go. Matt. Malinger. Oh, that's right. Malingering is a person who fakes an illness just for secondary gain. That's the difference between factitious and malingering. So I should have done it right after by proxy. So malingerer fakes an illness, but they do it for secondary gain, like they've got a malpractice going on, workers' compensation going on. They do it to get out of going to school, like little Bobby fakes illness so he doesn't have to go to school because there's an exam today. That's secondary gain. He's not just wanting mom's attention. This is secondary gain. You have to call it malingering now. Okay? Excuse me? Paranoid. Oh, that's right. I did under psychosis. I forgot it. It can also be a personality issue. So delusional and paranoid personalities. Oh, thank you. I forgot that guy. Please, if I forgot another one, blurt it out now. All right. Ooh, that should have been right after conduct and antisocial. I'm having too much fun up here talking about my stories. I'm forgetting things. All right, so let me do that. Oppositional. Let me write it down so I don't forget. Oppositional, defiant. All right, delusional is the person who has one falsely held belief. The best example I see on most test questions is the one I told you about earlier. It's always a guy who always thinks his girlfriend is cheating. All the way through his life, he's always had that belief. No matter how much proof you give him to the contrary, he still thinks, nope, she's cheating. Even though all his friends say, no, she's not. Pre says she's not. Everybody says she's not. She says no. Well, so in the delusional person, they just have been that way all their lives. Paranoid personality is a person who's obsessively worried about too many things all the time. So again, he's always worried about his job, the car, the kids, the marriage, the skies, the global warming, everything. Every day, all those things are on his mind. It's hard to be functional when you got that many things running through your mind every day. That's the paranoid personality. Again, multiple things. And then oppositional defiant is the person who hates people in authority. That's the difference between them and conduct disorder. Conduct disorder doesn't particularly like anybody. It's just they'll disrespect anybody's rights. Oppositional defiant, they're okay with anybody except if you're somebody in authority. So that means if you're a teacher, a policeman, a fireman, they don't like you. But if you're just the average Joe down the street, they have no problem with you. Best example here are the rappers. You hear the rappers in their lyrics, man, they hate policemen. I mean, they hate the teacher. People in authority, they don't like. But anybody else, they're fine. Okay? So that's the oppositional defiant personality. Okay. That should have been right after conduct disorder. All right. Anything else? Yes. Oh, that's right. Somebody said avoidance. The avoidant personality is the person who deals with life by avoiding any uncomfortable situation. Anything that has to do with rejection, they say, forget it, I'm not going. The problem is, folks, we all got to be social. We're all social human beings. So that means if there's a company party, you should come because that's how we all get together and have a good time. Okay? And if there's a company meeting, you got to come because the boss is going to be telling you what's going on in the company. Well, if there's somebody you don't like in the company, and just because he's going to be at a company meeting, you don't go. See, now there's a problem because you're going to get in trouble for it. Okay? Or you might even get fired for it. Then we say, okay, that's a personality issue now. Personality disorder. All right? So you can't deal with life by always running away from everything that's uncomfortable for you. All right? Same way in medicine. You're going to have patients who make you uncomfortable in the hospital or in the emergency room. You still got to treat them, folks. That just means you say, okay, this is just discomfort I have to deal with until I finish treating the patient. Okay? All right. Now, defense mechanisms, big picture first. A defense mechanism is the subconscious trying to protect the conscious. That's the big picture. Subconscious trying to protect the conscious. So let's see. We have Ferdy, Tony, Jessica, Pranima, and wait a minute, Manny. All right, Tariq. Who's to the left of Tariq? Put your head up for a second. Who's that? Oh, wait a minute, no, sir. Sophie's over there. Oh, man, I forgot. Just give me the first letter. What is it? Oh, Chukuma. Okay. And behind Chukuma? Brendan. Okay. All right. So Brendan, James. All right. Brendan, James. In the back. Oh, January. That's right. You were up here. Sorry. Okay. So Brendan, James. All right. I got to use these names I haven't used no yet. All right. Chukuma, Brendan, James. All right. Cool. All right. So defense mechanism is the subconscious trying to protect the conscious. Some of them are mature. Some of them are immature, folks. We all use them, though. That's the key point. All right. Defense mechanism. First one. Most common. Denial. What stage of grief is this, Tara? Stage one. Denial is when you don't want to face the truth. You do not want to face the truth. If you don't face the truth to help somebody else, then we call it isolation of affect. So these are forms of denial. This is like when a husband says, well, I got to be strong for my wife. It means I want to cry right now, but right now she's crying, so I'm just going to pretend like everything's fine and be there for her. That's what isolation of affect is. That means they got to tell me that the person's doing this for somebody else to say. You know, so a husband's dying in the hospital, and he seems cheerful every time the wife comes by or the children come by, and then when they leave, he cries. That's isolation of affect. He did that only for them. As soon as they leave, though, he goes right back to grieving. Okay, but he has to try to be strong for his family when they're around. Okay, isolation of affect. Well, another type of denial is when you're stuck in time. That's called fantasy. This occurs primarily after the death of someone. This is like a mother who leaves the little Joey's bedroom exactly the way it looked before he died, as if he's coming back. That's why it's a form of denial. So we come up with a special term for it, fantasy, because that's you're fantasizing like Joey's going to come back. A good example going on right now is Joey Fayed's father, the one that died when Princess Di. He's got Fayed's condo in England exactly the way he left it before he left that day. He will not allow the workers to take anything down. Don't move his clothes, don't move his shoes. Everything is there exactly as it was. It was on CNN on one of the channels. I said, ooh, that's a case of fantasy there. Because Joey's not coming back. They've already buried him. Okay, but that's what fantasy is. It's only involving the loss of someone. All right? And then when you do it subconsciously, then we call it repression. Repression is subconsciously blocking out. Subconsciously blocking out something you can't handle at that time. The problem, because it's subconscious, you don't even know you've done it. But then later on, it keeps rearing its head at something else. All right, so let's say a little girl got molested by her uncle. Now she feels betrayed by a male that she trusted, but she just blocks the whole thing out so she can go on with her childhood. But as an adult female, she hates every male that she sees. She can't even understand why she's mad at the policeman, the teacher, the priest, the grocer, the milkman. She hates every male that she sees. Doesn't even know why. It takes years of psychoanalysis to figure this one out. You know, repressed feelings. You got to do a lot of things like sentence completion, Rorschach test. What do you see on here? Well, there's nothing on here. Whatever you tell me is projection of what's in your mind. Okay, so repression. And then suppression is when you consciously block out something. Let's say you're in church And then you find yourself sitting behind some guy, and all of a sudden you say, oh my God, this is the guy that beat me up in 8th grade. You're like, man, I got slap him in the back of the head right now, boy. You know, and then I could run out the back of the church before he knows who even slapped him. Then you say, nah, better suppress that anger. The Lord is watching. As if the Lord only watches when you're in church. You know, but that suppression is when you consciously block out. All right, so those are all forms of denial. Okay? Other ones, rationalization. Other defense mechanisms. Rationalization is when you make an excuse for your behavior. If you make that excuse after the fact, then we call it justification. We went into Iraq. We said, hey, there's WMDs in there. We need to go in there. Rationalization. We got there. No WMDs. Well, hey, you know, Saddam's a bad guy anyway, so as long as we're here, let's get rid of him. Justification. Because you're making excuses after the fact. Okay? Projection. Projection is when you put your thoughts into someone else. The best example is advertising, folks. They flash things on the screen. All of a sudden, you think you need those chicken wings up there. You need the car. You need those shoes. You need that new dress they flashed up there. That's projection. Bing. Well, it turns out, folks, that projection is best done to the sides of the retina rather than straight on. Did you know that? Did you know that, Rebecca? Well, you ever wonder why when you go to a grocery store, everything is arranged in aisles to go past you like this? Why not just put them all against one wall so we can stare at it like this? Because your brain desensitizes it so fast, you don't even see half the stuff you're looking straight at. But if you're walking down the aisle and all of a sudden something goes like, let's see. It's more like it's your attention. Oh, folks, they do a lot of research to figure out what's going on. You don't think it consciously, but it happens. Okay? Projections, more to the size. Well, it turns out that projection is best done and strongest if done with something pleasurable. Well, in America, sex sells. That's why they use sex to advertise almost everything. They just put sex next to anything, it sells, right? You ever wonder why when you go to an auto show, they always got some cute little lady over there by that car? That's because they want you to walk by. Wait a minute, honey, let me go take a look at this Pontiac over here. You know, you see four-wheelers, and then there's all of a sudden there's a little one with a bikini standing right next to it. You're like, well, you know, four-wheel drive, that'll be better for wintertime. Yeah, I might think about that. Then you see a big old 18-wheeler truck magazine. What they got? A little one with a bikini standing right next to it. You're like, well, maybe four-wheel drive is not enough. 18 wheels will probably be better. It's going to be a rough winter. You know? All you got to do is put sex right next to it. It gets people's attention. Well, I know when I say that, women always think that I'm talking about men. Oh, no, that's not true. Women are just as sexual as men. They just know how to repress it very well. That's all. Repress or suppress it, whichever one they want. Well, let me prove it to you. When you walk up to all these ladies' magazines, how come they got all these pretty faces on there if it's not about sexuality? Oh, yeah. Women are just as attracted to sexuality as men are. All right. Look at the magazine like Cosmo. Has anybody noticed that there's always sex in 3 big black letters in every edition that comes out? Or is it just me who knows that? Okay. Yeah, everybody pretending it's just me now, right? Anyway, they want the woman to walk up to the, the counter, go pay the thing, and all of a sudden she walks by. Sex. Huh? Let me see. There's always sex in 3 big letters. How to have him come back yelling and screaming for more? 5 different ways. Ooh, that many ways, huh? 10 ways to help him find your G-spot. Good Lord, there's so many spots now. G-spot, QRST spot, KLMNOP spot. Too many spots out there. Cosmo seems to know where they all are located, too. That's why they always put them in big black letters, because they want you to buy it. Well, one time I said, let me pick up this doggone thing and find out where all this information is coming from. I thought this was for real. You pick it up, it tells you what page to go to, and guess what? There's a paragraph about that big that tells you something you already knew. But they knew it got your attention, so you would look at the magazine, so you would buy it. That's all it's about. All right, so they use sexuality to attract women just like they use it to attract men. All right, so that's projection. Displacement is when you take it out on someone or something else. That means you're mad at the boss, so you kick the wall. Well, the wall is not the person who made you mad, but you're taking it out on the wall. Or you go home and kick the cat. You're taking it out on the cat, but the cat's not the one who made you mad. It's your boss. That's displacement when you take it out on someone else. One they love on, of course, is the Three Stooges. You know how Mo always hits Curly, Curly hits Shemp. I mean, that kind of thing. That's displacement. All right, because you're slapping the person who did not slap you. You're taking it out on someone or something else. Okay? So, justification, projection, and displacement. Splitting, we mentioned, is just seeing everything as black and white. Seeing everything as black and white. Counterphobic behavior. Counterphobic behavior, look at the word. You got to have a phobia first, then you do the opposite to counter it. Just like somebody who's afraid of heights and he takes up bungee jumping. Now, while you're up there with a rope tied around your ankles, nobody would ever think to ask you, are you afraid of heights? So it's still a way to hide, but you're hiding while you're desensitizing yourself. So you're countering your own phobia, counterphobia behavior. First is reaction formation. Reaction formation is when you act opposite to how you feel. So let's say you're sad today, so you act extra happy. That way nobody would ever think to ask you if you were sad. Let's say you broke off with some boyfriend, and then you go to a party. And there he is with another woman that you know. And so what do? You try to avoid them. But doggone it, they didn't run into you while you were at the table trying to get yourself some hors d'oeuvres. You turn around, oh, hey, how you doing, Johnny? Everything going okay? Oh, Susie, you look nice. That's a very nice dress. Yeah, how's your mom doing? Oh, and your brother, everything okay? Well, I'm going to go join my friends over here, okay? You guys have a real good time. It's so nice to see you guys. And then as you walk away, that bitch, I knew it. Stole my man when I wasn't looking. We all do it, folks. We all do it. Okay? Because you can't always tell everybody your honest opinion. I mean, when you know it's going to hurt somebody's feeling, you fake it. You just make up something. All right, that's reaction formation as well. That's why I say some of them are mature, some of them are immature. But we all use some form of most of these. Okay? So reaction formation. Sublimation. Sublimation is making something positive out of something negative. Making something positive out of something negative. Good example. Let's say you're a fighter. You like to box. You like to beat people up. Well, that's negative. But if you fight in a ring and beat them up in there, then it's okay. You say, okay, that's sublimation. Another good example of sublimation right now in society is like the Susan B. Komen Breast Cancer Research Foundation. That woman's sister died of breast cancer. And rather than lamenting, crying, and being depressed about it, she said she was going to do everything she could to make sure other women don't die from breast cancer. That's sublimation, making something positive out of something negative. Another good example, your little Johnny dies, and you donate all his organs so other kids can live. That's sublimation, okay? Making something positive out of something negative. Then there's intellectualization. Intellectualization is pretending like you know it all, but it's to hide your ignorance or your fear. Now, in medical school, you know, there's always that one guy in class who swears he knew everything about medicine already because his father was a doctor and his brother's a doctor, all that stuff. He just thought he knew everything already. I always used to look at that guy and say, man, why don't you just stay home and just mail you the diploma? I mean, if you know that much. You know, instead of coming here to make us all feel bad because you're at the top of class and we're all struggling. All right, so that's intellectualization. That person is really insecure. But they'll talk about, that was such an easy test. And, of course, I'll come out here and I was struggling to get that exam behind me. And they just make other people feel bad. Okay? That's intellectualizer. Okay? Then there's undoing. Undoing is when you do the exact opposite of what you used to do. Undoing is when you do the exact opposite of what you used to do. Like, you used to set people's houses on fire. Now you're a fireman to put out those fires. That's undoing. It has to be the exact opposite of what you used to do. If you do something to make up for what you used to do, then we call it compensation. When you do something to make up for what you used to do, then we call it compensation. So let's say you used to burn down people's houses. So what do? You donate money to the fireman's fund. You don't go put out the fires. You just donate to the fireman's fund. That's compensation. A guy who abandons his child when the child was young and then starts donating to orphanages because now he feels remorseful for having abandoned his own child because you can't undo that. That's called compensation. When you do something to make up for what you used to do, then we say compensating. Okay? Lawyers make a fortune out of compensation, right? You lose something, you should be compensated with this many dollars. You lose a child, you get this many dollars. You lose a brother, you get this many dollars. I mean, it doesn't take the place of the person, but it makes you feel better, or it's supposed to make you feel better. So undoing and compensation. Then there's a series here. Idealization, idolization, imitation, identification, and sexualization. All right, these are pretty similar. Idealization is the feeling that things always have to be ideal. This is like the female who just can't seem to find the right man because she wants a man who's just like her father. In her mind, if you're not exactly like daddy was, you're not a good man, period. That's idealization because nobody's ever going to measure up to daddy. All right? So the feeling in your mind that everything always has to be ideal is idealization. idolization, idols. Idolization is the, ascribing your success to something else. Rabbit's foot, your lucky rabbit's foot, your lucky pair of shoes, that kind of thing. Idolization, okay? This comes from the old, the biblical times of building idols. Now, every religion has some level of idolization. Let's say in the Catholic Church, you have a statue of Mary, but we don't believe that is Mary right there, okay? Now, in the biblical times, they would take all their jewelry, melt it down, and make a calf. All of a sudden, the calf is the god. And that's idolization. All of a sudden, now the calf is the god. A minute ago, it was rings and chains. Now it's a god, okay? In today's times, there's like a guy named, who's that runner with the golden shoes? Anybody know who I'm talking about? Who's that? Yeah, that's it. He thinks his speed is due to his gold shoes. He would not run a race without those gold shoes. Well, your speed has nothing to do with your gold shoes. It has to do with your own athleticism. Okay, but he feels in his mind it's the gold shoes that makes him that fast. All right, that's idolization. A kid who thinks he can't win a game without his lucky glove, and that's it. So he thinks all his success is due to his lucky glove and nothing else. Okay, that's idolization. Imitation. Imitation is when you dress like somebody you admire. That means that it has to do with, no, sorry, the other way. Imitation is you just want to be like the person you admire. Identification is when you dress like them. What is it? Advertising uses imitation and identification all the time. Because when you put an athlete up there, they know that people will want to imitate the athlete. And they're hoping that people will identify with the athlete and wear the same clothes he's wearing. Just like Michael Jordan shoes, Michael Jordan shorts and Iverson, wristbands, all that stuff. That's identification when you feel like you have to dress the same way that other person does. If you just say, hey, I want to be like Mike, that means I want to do the moves that Mike does. That's imitation, okay? Or kids doing a crossover move. That's Iverson, imitating Iverson. That just means you want to imitate somebody. You want to be like somebody, but not necessarily wear his clothes, okay? Once you start wearing their clothes, that's called identification. Now, one I see a lot on board questions is, the guy whose his best friend dies in a car crash, so he always wears his friend's jacket from then on. That's identification, okay? Sexualization is the thought or act of making something sexual out of everything. Obviously, men are real good at this. Let's say if you got a sexualizer, man. Let's say he's walking along, misses his girlfriend or something, and he sees a tree swaying in the wind. He looks like, oh, man, look at the tree. Ooh, moving like a sweet pair of hips, man, look at that tree. I mean, making something sexual out of a tree just swaying in the wind. That's sexualization. All right? Then a lot of mature ones, altruism. Altruism is putting others before self. A parent does that for a child. A sibling does it for another sibling. Okay? A spouse does it for another spouse. Altruism, putting others before self. Okay? Philanthropy. Philanthropy is monetary giving to those less fortunate. Monetary giving. It has to be something monetary. Gifts, paintings, leaving money in your will, that kind of thing. That's philanthropy. Donating to a worthy cause. That's philanthropy. Monetary giving to those who are less fortunate. Okay? Then there's humor, the most mature one. There's two types of projection that you need to be aware of. One is called transference. And the other one is called countertransference. Transference is when a patient projects to the doctor, which means you remind the patient about something about their mother, about their father, and they start talking to you as if you are their mother or their father. That's transference. The patient projects to the doctor. Countertransference is when the doctor projects back to the patient. That's usually considered negative most of the time. Rarely is it ever positive. Good example, let's say you got a doctor who beats his wife. And so you got a battered woman that comes in to see him that day. And so she says, oh, doctor, my husband beat me up last night. And then he responds, well, I'm sure you did something to deserve it. What was it? You see that? Blurting out your belief. You can't do that. All right? Which means when you take that Hippocratic oath, folks, we pledge to treat any and every one, regardless of what their background is. So you can't say, oh, because, he's this, I can't treat him. Or because he's that or she's that, I can't treat him. You'll get yourself in big trouble. Remember some of the pharmacists who did not want to prescribe the morning after pill? You guys hear about that? Oh, yeah, they quickly learned about the oath they took when they became pharmacists. You can't do that. You can't suddenly start bringing your beliefs to work. The key is when the career says this is what we're going to prescribe, you have to prescribe it. Well, if you don't believe it, then get out of the career. Okay? So you lose money. You get sued. You're going to lose that. You got no leg to stand on. That's why you got to be careful about your emotions. If you bring your emotions to work, you'll get you in trouble. Okay? Because we contracted to help people. And in fact, you find out you're more married to your work than any spouse you're ever married to. And that's why you have to really play this balancing act between your relationship and your career. Okay, that's why 8 out of 10 physicians end up divorced. Now, I don't wish that on anyone, folks, because a married life, I tell you, is the best way to go, man. So I'm telling you, fellas, find yourself a good woman. Ladies, find yourself a good man. Now, I know that's hard to do, so you ain't got to tell me. Well, here's the problem, man. You're in medicine as a female. I always tell the females I feel so sorry for you because you're in a very limited population. You're in medicine, higher education. And then you say you want a good man. Okay. Then you say you want a good man who's confident in himself. Okay. You say you want a good man who can understand that you're smarter and achieve more than he does. Yeah, it shrinks down just like that. Oh, my goodness. Most men cannot handle a very successful woman. The other way works out okay. Successful man, well, that's just normal society. But for a very successful woman, a lot of men, probably 7 or 8 out of 10 men can't handle it. Well, I always kid with the class. I said, you know, I've been with my wife now for about 20 years. I ain't going nowhere, man. Staying right here. I mean, I'm telling you, she could stab me in the back. And I end up at that courtroom. That's all right, Judge. That's all right. It's just a hemisection. It's just a hemisection. The right side still works. Let her stay. Let her stay. Because I ain't going back out there, man. It's dangerous out there. It's dangerous out there. All right. So humor is the best one because obviously that's my defense mechanism. I learned years ago, learn to laugh at yourself. Folks, don't take things so seriously. You know, life is so much more beautiful as long as you keep this kind of a childlike. I didn't say childish. There's a different childlike attitude about life. That's my approach in life. Is just let things bounce off me. Simply because I want to keep my mind positive at all times. So it's not that I don't know there's negative around me. I just choose to ignore the negative so that I can accomplish positive. And that's the way you got to be in medicine. That means you never let any dean talk you out of whatever your dream is. It doesn't matter if you fail the boards once, twice, 3 times. You can still get that residency that you want. All right? So one guy always likes me to tell his story. His name is Toikis out of Meharry. Toikis was one of the first few students I took through the program. He had failed boards 1 9 times, failed boards 2 8 times. So I had helped 5 females from that school. Meharry was one of the few schools that would let students graduate without actually passing the boards. This was years ago. No school does that anymore, as far as I know. But we had helped like 5 students pass their boards. So, you know, the dean got wind that, man, these students who had never passed their boards finally passed after they went to the pass program. So we had started communicating. I said, hey, find me all your graduates who's ever graduated and never passed their boards. Send them down. I'll show them how to pass the boards. Well, Toikis came to me so depressed and down and everything else. And I told him, hey, man, don't even worry about it. I'm going to show you what's really going on in that exam. You know, and I just talked it up because I was trying to get him to get his spirits lifted up. Once I sold him on that it is possible, you're going to pass the exam. You even have to fail it 9 times, 8 times. Don't even worry about it. And you'll still get the residency you want. Well, he was here and we worked with him and he passed boards 1, scored above 200. Then I said, well, why don't we knock out boards 2 as long as you're here? I said, just stick around. I said, it's the same exam, different words, but I'll show you the same thing. 4 weeks later, knocked out boards 2 with no problem. And then he applied for residency. While he was waiting to hear about his residency, I said, hey, Toikis, boards 3 is the same exam, man. I said, as long as you're here, man, why don't we knock it out? He said, I thought you got to do a year of residency for boards 3. Toikis, scam. That's a lie. You don't need that. Let me tell you what's really going on boards 3. So a month later, knocked out boards 3. Okay, so that's what I'm telling you. There's a lot of wrong information being passed down to you guys. But the key is if you understand the core information, folks, no exam deviates from it. Same concepts and clues on every exam I've ever looked at. Okay? Different questions. That means if you get buried in that question, you won't see it anymore. It's like that mural on the wall. Which one are you going to see? Tile or face of Jesus? Okay? So Toikis got his first choice, which was LSU, one of the LSU hospitals. When Toikis got there, now notice he passed his boards 3. At the end of the first year, you take an in-service exam. He passed his in-service exam, and when the other residents took boards 3, he found out he had outscored most of them on his boards 3. That's a guy who failed 9 times, 8 times. You would never predict he would outscore most of the residency staff, but he did. In fact, he was so successful at being a resident at that hospital, they were so impressed with this guy that how did he know how to put all this stuff together? You know? And, I mean, he would always email me and tell me just how much fun he's having because he was getting compliments from all the attendings that they can't believe he had any academic problems because he seemed to understand it better than the other residents. He ended up being the chief resident. You would never predict the guy who had that much problem would be the chief resident at that hospital. Well, they got so impressed with past program that they started to recruit so many past. There's about 7 past program students who've gone to that same hospital because they were that impressed with Toikis. I'm telling you, he's blazed a trail. You know, I've had a couple of my students now at Johns Hopkins. I mean, folks, don't ever let anybody talk you out of your dream. If you truly want to be a physician, then the key is to learn how to be a good physician. Okay? It wouldn't take me long to teach you how to take a test. I don't want you to learn how to take a test, but you don't know how to be a good physician. I'm here to teach you what I think is right, which means how to be a good doctor. Okay? I'm not even to teach you just how to pass a test, but you still don't know what you're doing. Okay? But I don't want you to know how to be a physician, but you can't pass the test. You can't get there either. So that's why we do it in a 2-step. I'm teaching you the information, the way you should understand it, but at the same time, we're going to sit down with you and teach you how to take a test. That's a whole different task there. Okay? So the key is, when we're going through these the terminology, you got to know the small difference between each one. That's what they're going to be putting somewhere in that vignette. And once you see that key difference, aha, you already know the answer. That's the way I want that exam to be for you. Aha, that's the clue for a blank. Boom, click, move. This way you're not swimming through all the answers, and then before you know it, you're lost, and you don't know the answer anymore because you've seen something that sounds familiar. And they know how to do that. They put things that sound familiar straight out of your first grade, straight out of your Robin, straight out of books they know you've read. However, like I told you, a lot of books write about the esoteric, the 10%, but they never tell you what the 90% in the process. On the exam, they ask you about the 90%, not the 10%. That's why then if you quote what's in the book, you find out later you missed it. That's not really what they were asking for. Okay? So very important. Learn to laugh at yourself. Learn to laugh at the world, man. And they came in handy. One time I was on the ball court, right? This is in Chicago now. I've seen a lot of guys get their butt whooped and someone get killed over a basketball game. So I always say, there's no reason I'm going to be fighting over a basketball game. I said, if my life or the life of my loved one is not in trouble, we can negotiate. Because I'm going to be the first one to back down. Because I don't feel like fighting over things that are just so crazy to me. People lose their lives over silly things. Oh, he fronted on me. What the heck is he fronted on me? Just because he looked at you the wrong way. So now you're going to shoot him. Now, he's dead. You go to jail for the rest of your life. So now what? You got revenge? I mean, to me, that's stupid. But that's the way these kids are thinking these days. So that's why, to me, I'm not going to be fighting over something silly, because you think you're getting in a fight, and all of a sudden guns pull out, and you're a dead man now. What have you won? Nothing. And you haven't made any points. So, you know, the guy starts a fight. You know, he wants to start a fight. Back in the day, you know, now I feel the old generation, back in the day. Back in the day, if you say, yo mama, those are fighting words. Remember I told you, 60% of black households only have a mother. That's the most precious person that guy knows. You say something about his mother, we're about to fight. So that's all you have to do. If you want to start the fight, say yo mama. So of course that's the first thing. He said yo mama. And I said, oh well, my mama's doing fine, man. But I'll tell her you asked about her. You know, I said take the ball, man. Let's go. Let's play ball. You know, so he still wants to fight. He pushes me again. I said, man, I don't want to fight you. It's not over a doggone pickup game. I said, take the ball. He said, man, I go to hell. I said, well, you know what? I went there last week. I met your mama. Didn't like her cooking, so I came back. He just started cracking up because he had never heard that before. I picked that up from some comedian years ago. But I'm telling you, how do you fight a guy who's got you laughing that hard? But after that, boom, diffuse it. Diffuse the whole situation. We went back to playing basketball. So that's what I learned. Humor is a very powerful weapon to get people to relax